Hello, my name is Sean Park, a prosthetic urologist practicing in Seoul, South Korea. So mostly what I do is erectile dysfunction treatment. As I discussed it about before, diagnosis itself has a little meaning when it comes to erectile dysfunction. Because even though we do a world-best diagnosis, treatment there's no change with how we treat the patient. After that, I try to be pragmatic. So focusing on the treatment is better for the patients. In this section, I wish to talk about treatment options for erectile dysfunction. And among them, we have 4 options: pills and injections and surgery, a penile implant, and the 4th is extra shockwave treatment. So among these, today I'm going to talk about the pills. As you may know, Viagra was a revolutionary discovery when it comes to the erectile dysfunction treatment. Before Viagra's discovery, we urologists or we doctors really didn't understand the mechanism of the erection. We thought it's probably because of the mental issues or something like that. So psychiatrist was the first who generally treat the erectile dysfunction. Most of them went to the psychiatrist. Only 10% of the patient came to urologist to get the surgical treatment, which is a penile implant. After the Viagra's discovery, we then understand erection is really a function of the artery. The blood goes in and then it becomes more like a water balloon made out of blood and a very tight, very tough outer layer. So there are several types of the pills on the market. Of course, you need a doctor's prescription to get it, to buy it, at least in Korea. Sildenafil, and which is a Viagra, and there is a tadalafil, which is a Cialis or something similar. But the first thing we have to know is that if the Viagra is not working, there is a good chance that Cialis, the other type of the erectile dysfunction drug, may not work neither. The reason why we have several types of drug, and that for me, at least, I prescribe this type of drug and that type of drug at the same time and let the patient try it. Not because this one will work, this one will not work. No. If it works, this will work as well. However, side effect profile is different. So how are these pills work? Basically, they are circulation enhancers. So they will send blood to the organ that demands blood flow. They will send blood more effectively than before. So that's why these pills work with the erectile dysfunction, which means that this drug is not just for the erection, actually. It shows a systemic effect. When we take any kind of these kind of pills, the first thing we will experience is generally headache and the facial flushiness and nasal stuffness. Then we can experience palpitation or the gastric acid secretion or muscle pain. One of the most common misunderstanding with these pills is that if you take it, you will have an erection. No. When you take it, it will help you get a better erection. Why? Again, this will only work when the organ demands the blood flow. So it will not send the blood flow. It will help them have a better blood flow. Many patients ask me that, Doc, I tried the pills, but sometimes it works, sometimes it doesn't. The first one we have to understand is that we have to take it in the proper way. These drugs are absorbed through our stomach. So if the stomach is filled with the food, this seldom works or the effectiveness goes down. So I recommend to take it at the empty stomach, like before the meal. And you have to take it at least 2 hours ahead of the intercourse. And when it comes to define whether this drug works for you or not, you need to take it at least 4 times. And as you know, our condition varies, like day by day. Today I have a better condition, which means that probably your circulation is better that day. And today I feel, groggy and tired. Yeah, maybe your circulation isn't that great. You drink too much or you overworked or you couldn't sleep well, something like that. And because of that, this drug's effect can show, variability. It's up to you how to, see its effect. And about the side effects, like I said, generally patient will have those symptoms for a while. But if you take, if your body is more accustomed to it, then patient has a less discomfort. But still, in one study shows that among the patients who prescribed Viagra, after a year later, only 20% of them came back to get a represcription, which means that this drug can have some side effects that really bothers the patient. And this drug is not perfect. Some patients respond to it. Generally, about 80 to 90% of patients will respond to it, but those 10 to 20% of the patient will not respond to it, even though they have a healthy system. These drugs are generally very safe and has no impact on the body, and they do not develop any resistance. But over the time, these drugs will not work, not because of the resistance, but because our body gets older and our vessels, especially penile arteries, getting weaker as we get old. So that's the reason why you don't really have to start with the low doses. So usually I go with the maximum doses, and if the patient works well, we do it. But if the patient suffers too much of the, side effects, then we'll lower the dosage. There are two conditions that you should stop these drugs. The first one is if after you're taking the pills, if your vision becomes more like a bluish, then you should stop it. This is because some patients, they have a congenital condition in their retina, and that can impact their visions if they take it for a long time. So in a case like that, you should consult with your doctor, and you should stop taking the pills. The other condition is that if you have a tinnitus after taking these pills, especially tadalafil, like a Cialis, then you should stop the pills as well. It usually comes in the one side of the ear. But if you keep taking the drug in that condition, there's a chance that you will have a sudden hearing loss on that ear. If that happens, 50% of the patients will lose their hearing. But hearing loss is not just confined to the one side. Once one side of your ear loses hearing, the other side will eventually lose your hearing as well. If you experience that condition right now, then you have to consult with the ENT specialist. Generally, they will try steroid pulse therapy, which has a 50% chance of the remission. It's extremely rare condition, as 1 out of 500,000 or something. So other than these two, you really don't have to worry about other side effects, because those are transient, and you can recover from those completely if you stop taking the pills. In a nutshell, pills are a very effective treatment and quite safe. If you only take a precaution of the two conditions I mentioned, you will have no problem taking it. And just like any other pills, we recommend to take it on a recommended dosage. Generally, Cialis is about 20 milligram, and the Viagra is 100 milligram. If you take 200 milligram, the effect will be double the effectiveness? No, that doesn't go that way. There is a ceiling effect with the pills we take, which means that let's say there's a cup, you pour the water. You can't really contain the water over the size of the cup. But if you keep putting the drugs into your system, then the others will spill out and become side effects. Generally, what we recommend is that you keep the maximum dosage so that you can prevent any other unexpected side effects. Okay, so I hope this helped you understand the pills better, and hope you could have some good results with it. I'll see you next time talking more about the erectile dysfunction treatment options.